Okay, about 3 minutes early. Okay, that will give me enough time to introduce our first. Before I introduce our first speaker, let me just share with you the program again so that we make sure we are tally. Okay, so we will start today. Just give me a minute. Okay, so today we'll start with the lecture by Mr. Ranjan on law and practice at 10:45. We will talk about medical records by Dr. Zaina Fitri. And we join all again at 1:45 for medical ethics. And we end with the lecture on prescribing and referral by Dr. Kavi. Okay, so we end maybe just before 5. Okay, so it's a long day. So make sure you are around. Okay. So I see Mr. Ranjan is already around. Okay. Good morning, Mr. Ranjan.
Good morning, Dr. Navin. How are you?
I'm okay. I'm good. I'm good. Okay. Thank you very much, Mr. Ranjan, once again joining us. Are you in the country or
Uh,
outstation?
I am in Australia, but
Okay.
but always ready.
Yeah. Thank you.
To
So is
assist.
Australia now is around what time?
2 hours ahead.
2 hours ahead. Okay. All right. Nice thing to know. Okay. All
Mm.
right. Okay. And just to answer one of the candidate, yes. Just put your full name. Just put a full name in the Zoom. Like my name, instead of putting NKD, I put Navin Kumar Devaraj. Okay, so that everybody can record and make sure you are around, because if you are not around, then you can't sit for the exam later. There may be some issues there, lah. But no worries. We not to penalize, but just to just to enrich you with more knowledge in this workshop. So let me just share the slides by Mr. Ranjan, and just a brief introduction for Mr. Ranjan. Can you see the slides? Can just shout out anyone if you can see.
Yes, Doctor.
Okay, thank you, thank you. Okay, so Mr. Ranjan is an illustrious solicitor and advocate. Okay, so initially he was called to the bar. Okay, in 1976. Okay, and he's also a member of the Royal Society of Medicine UK and also the Medical Legal Society of Singapore. So he's a very renowned advocate and solicitor. Okay, so he has also spoken a number of times at congresses
Mm.
on medical law and AFMA, MPL Association and Royal Society of Medicine. Okay, the International Association of Forensic Science. Okay, and as far as I know, some high-profile cases involving medical law, I think he has taken and won, if not all, majority of it. And he's also very actively involved in charity. As you see, he's a member of Anti-Slavery International, which is the World Order's human rights organization. Okay, and he also takes part in long-distance running, uh, mainly for charity purposes. Okay, so without any delay, I'd like to welcome Mr. Ranjan to give his lecture on practice and law.
Right. Thank you, Dr. Navin. I suppose that all these materials will be provided to all participants. All right.
Yes, it will be in their
Right.
e-portal, learning portal, okay, for everyone.
Yes. So we will go to the fourth slide straight away. Right.
Okay, you can see this picture of
Uh,
Mr.
running for 10
Yeah,
kilometers for
running
anti-slavery.
for charity. Okay.
Right. And some of the background material are already there with you. So
Okay.
please read uh, the material in your free time. The idea is to give you some, as I said, basic, starting material on what is involved in the interaction between law and medicine. Today, we will focus on the subject about how to avoid medical legal problems, and also we will undertake some case studies. All right. So let's go to the second slide. Now, there will be medical legal problems leading to, for example, claims, inquiries, even human rights inquiries, criminal proceedings, disciplinary proceedings, defamation cases, and things like that. Let's go on. So a doctor can be a defendant to a claim, can be an accused person in a criminal case. You would have heard recently, right, of a doctor whose case went up to the federal court. He was found guilty of murder. But the charge of murder against that doctor was not in regard to his practice. But in that case, there were a number of medical legal points which came up. A post-mortem examination was undertaken, for instance, and then issues like the cause of death were raised. But of course, we have had doctors being charged in court and even found guilty for offenses in regard to their practice. An example, say, false medical certificates. Another is, say, like performing an illegal abortion. There are exceptions given to doctors about terminating a pregnancy. But the general point will be a pregnancy may be terminated on sufficient medical grounds, not upon request. A doctor may be charged with misconduct, for instance, in the medical council or in a department inquiry. A doctor may be called as a witness in a court case. And sometimes, a doctor sues somebody else or complains about another person because that person may have made some remarks about the doctor, say. Or doctor may have impaired fitness to practice. All these kind of issues arise. So please keep in mind regarding the various kinds of issues that can arise. The background material would be of assistance to you. Let's go on. Let's go on to the next slide. So there can be issues for the doctor regarding reputation, money, personal and professional interests. Can you imagine now if you are sued for negligence and the case goes on for 10 days in court? Every day your name comes out in the media, say, that you've been sued over something in regard to your profession, say. Then on the 11th day, the judge finds you not negligent. But imagine, for 10 days, the accusation against you is there in the media. Only on the 11th day, you are cleared of it, say. But do you get that published 11 days? No. Can seem a bit unfair. All right. So please keep in mind that point. All right. Let's move on. So the doctor as a witness, so there can be a subpoena issued, say. A subpoena is a serious kind of document. Don't take it lightly. A doctor must be paid fees and expenses. And a doctor, say, comes to court, the doctor will be concerned about his or her credibility and reputation. So be careful about what you say in court. That it must be true. If you're stating an opinion, you must have sufficient grounds, for instance. Let's go on. So doctors have duties to their patients and their families. Also to the community. And they have duties to their profession and to colleagues as well. Now, I think a very important point, including particularly in the field of family medicine, a doctor should see himself or herself as a member of the community. And when as a member of the community, it's helpful to know about issues which arise in regard to your community. Very important. There can be something, say, about, say, infectious diseases spreading within the community, say. Or maybe there's an issue about, say, child abuse in a kindergarten in your community, say. And parents may be very, very anxious about what had happened to their children, say. They may come and see you. By the way, there's a horrific case. In fact, there are two horrific cases going on in Australia at the moment. Two young men have been charged with serious criminal offenses. They were working in childcare facilities. And most of the victims were between the ages of 5 months and 2 years. The authorities have called upon parents to get their children tested for infectious diseases. Translation, translation, venereal diseases. Horrifying. But keep in mind this, important. It's not just about, shall I say, knowledge regarding medicine. It's about being in the community. When you know your community well, it assists you in the discharge of your professional duties. Let's go on. So, what are the common causes of medical legal problems? Administration and clerical errors and system failures. Let me give a few examples of administrative and clerical errors and system failures. There was a soldier who had a military, card. He had a military number, and he also had an IC number. In the hospital, two different files were opened. One with his military number, the other with his IC number. Can you imagine the mix-up? Information goes from is not complete in each file. And that patient had a problem regarding certain medicines. He was allergic to certain medicines. The result is he was given medicine to which he was allergic and suffered an accident. Administrative and clerical error. System failures, say. To give an example about, say, informing staff who will be on the roster, say. You may have a busy clinic, say, operating, say, 16 hours a day. You can't have all your employees working for 16 hours. They have to give, so there'll be rotation, say. Making sure that the roster is followed, for instance. There can be poor communication, say. Inadequate records. Working beyond the level of competence. So, we will show through the case studies, examples, working beyond the level of competency, or delegating to those without the necessary training and experience. Insufficient clinical assessment of cases. Now, if you have undertaken sufficient clinical assessment of cases and accidents occur, it will be easier to defend you. But you have not undertaken sufficient clinical assessment, say. Suppose, say, didn't undertake take a proper history. Suppose you did not order certain investigations which should have been ordered, say. And suppose you did not read the medical records. There was a famous case, one of the earliest in the country, the Chin Kiao case. It happened around 1960. The patient had a known allergy to penicillin. It was known. She had gone from one clinic to another clinic in the government. But she told the clinic nurse, I want to tell the doctor about penicillin. The doctor should have been alerted by the nurse. Patient wants to talk about penicillin. Then the doctor should have asked, why do you want to talk about penicillin? Then she would have told him, I have a known allergy. The doctor gave that patient penicillin and she died within half an hour. So that claim succeeded. Next, please, one more thing I want to tell you. Just because something goes wrong doesn't mean that there is negligence. If you have acted correctly, you cannot guarantee a good result. There can be patients who have no known allergy and yet they drop dead, say. I had a case some years ago. Patient was given streptomycin and he died shortly after the injection of streptomycin had been given by the general practitioner. Now, in his clinical records, it was shown that he had taken streptomycin twice before by way of injection in that same clinic. Yet he dropped dead. Such things can happen. Sometimes the patient can become sensitized to a drug. So the first time may be all right. The second time suffers a terrible reaction, say. There can be cases where you have done everything correct and yet things go wrong. You may have told the patient, "You look all right. I've examined you. I've investigated your condition, etc." And all that. You have made a recovery from your say infection. Patient goes home and drops dead. Proves you wrong. But please keep in mind one point. The public frequently complain, oh, the doctors are always negligent. They like to use words like always. There are a lot of things go wrong in hospitals and clinics and all this. They will complain, complain, complain. Now, the law of negligence applies to doctors. But let me give you this point. The law of negligence also applies to motorists and that subspecies, motorcyclists, and another class of people, pedestrians. They too owe a duty of care on the roads. Now, which happens more often? Negligence on the roads or negligence in hospitals and clinics? What do you all think? Anybody wants to guess, say something? No. Nobody wants to say it.
On the road.
Sorry?
On the road.
Doctor.
Yes. So the next time, say at a party, somebody complains about how doctors are negligent, you say, this old man lawyer, he said, he has seen more negligence cases on the roads than in the hospitals and clinics. I'm trying to get a gallery view. Let me see. Let me. No, but then some of you don't appear. Wait, let me see. Where is the gallery? Yeah, where is it? I've lost it. Wow. Where is it?
Your slides, is it? Is that
No. So, I mean, the participants on view, some of them are hiding themselves, huh?
Yeah.
Never mind, we'll go on, okay?
Okay.
You have the right not to be seen, but you have the duty to listen.
Yeah.
Let's go on. Let's go on, please. Right. The common types of claims. I mentioned negligence. But keep in mind, negligence is not just about road accidents. It's not just about hospital and clinic accidents. It can be about a lawyer's negligence. It can be, say, an accountant's negligence in so many situations. So, negligence involves breach of the duty of care, causing reasonably foreseeable damage. I don't know why I keep getting an alarm, here. Let me cancel it. Right. So, reasonably foreseeable damage. Now, when you see a patient, you have a duty of care, right? Take the history, take the complaint, examine the patient, order investigations, all these things, come to a diagnosis, provide treatment, give advice and information in all this. Yeah. And if you are in breach of the duty, whether the damage that you caused was reasonably foreseeable. If the patient has a known allergy and you give the patient a drug to which that patient is known to be allergic, it is reasonably foreseeable that the patient will suffer harm. We lawyers like to talk about reasonableness, But how many reasonable people are there in this world, actually? Not easy. But let me give you an example. You are driving on the highway at night. It is raining. Your car headlights are giving trouble. One of the headlights is out. The windshield wiper is not working properly. It is raining. You are driving over the speed limit. Can you see? You have a duty of care, but you're in breach in a number of ways. One is you're driving too fast. You're driving a car which is not fit for driving on the highway that night. Is it reasonably foreseeable that you will cause an accident?
Yeah.
Right? Look at it that way. Yes, you will, right? reasonably foreseeable. But not everything is reasonably foreseeable, you know. About 50 years ago, a woman in Czechoslovakia decided to commit suicide because her husband had left her for another woman. So she jumped off the balcony of her apartment and landed on a pedestrian. She survived, her husband died. Do you see the point? Who was the pedestrian? Any answers?
The husband?
The
Yes.
husband.
Was it reasonably foreseeable that she will land on her husband? Poetic justice, huh? But what is the moral of the story for the men? When you walk down a street, look up once in a while. Right. So not everything is reasonably foreseeable. Battery, that's one. An intentional wrong. For instance, treatment without consent. Molesting a patient. Even though there's no damage, it is still a wrong. But that is something intentionally, whereas negligence is a different form of wrong. Huh? What do you do negligently? You don't intend it. Battery, you intend to do it. So we had a case once, you know, as stewardess, she had problems with her middle ear, you know, sense of balance was affected because sometimes when she flew, she had this problem. So she had to undergo surgery on her right eardrum. You know, myrongotomy with the insertion of a grommet. What happened was the surgeon, by mistake, having taken consent for the right eardrum, operated on the left. So he had treated her without consent. So it was a case of battery. It was also negligence. Right? Let's go on. Now, not so common types of claims: breach of confidence, of misuse of confidential patient information. There have been a number of cases in Singapore, you know. Computerized medical records were hacked. And a lot of confidential information was leaked out. In one awful case, I think more than 1,000 HIV positive patients found that their records had been hacked and leaked. Right? So there can be loss of or damage, say, to patients' belongings. Defamation of a patient. So be careful about what you say about a patient. So it's not easy being a doctor, but important point, you know, there are heavy duties cast upon doctors, but they also have important privileges. They are privileged, say, in various ways. They treat patients. They have the duty to examine a patient, but at the same time, they are privileged in that sense. Let's go on. So, a basic point. Administrative and clerical errors and system failures are more difficult to defend than errors of professional judgment. So, to give you more examples of administrative and clerical errors: wrong patient, wrong side, wrong drug. All these are difficult to defend. But error of professional judgment, say, the doctor comes to a conclusion that the patient is suffering from, say, an infectious disease, when actually it is something else. Diagnosis errors can occur even though you exercise scans. You can never get your diagnosis correct the first time. Sometimes, with time, you learn more. You try the treatment, it doesn't work, the patient comes back, see. And then you find that you have to review your diagnosis. Sometimes the clinical picture becomes clearer when the patient comes and sees you the second time. But there'll be patients who will complain, no, This first doctor, very stupid one, gave me this medicine, no good. Then I went to the second doctor. That one, some improvement, no, but the third doctor was very good. But the third doctor has got the advantage of seeing what the first and second doctors had gone through. So it's all very easier to be clever after the event. But I think this is where you have to be also very careful. Huh? Don't make unwarranted remarks about your colleagues. It's so easy to criticize somebody else, especially someone who's looking at the case at the beginning, when, say, the situation is not so clear. So be cautious. Sometimes, of course, you may get it right when you criticize, but I think you have to exercise some caution. I have seen cases of doctors making rash remarks and then finding that a medical legal case arose out of the rash remarks. I'll never forget, one of my earliest cases was of a dental officer in a big government hospital who wrote in his notes of a patient who had been seeing a general practitioner dentist in the private sector. And the patient developed a serious infection because he has defaulted in treatment. And so the antibiotics were completed, but he had not gone back for follow-up. So a persistent infection. And this dentist wrote, radiologically, there appears to have been surgical exploration beyond the inferior dental canal. So he gave a surgical cause to it. Now, there was an extraction done earlier by the private dentist. Post-extraction, X-ray films were taken and they showed that the patient did not have surgical exploration beyond the inferior dental canal. What had happened was about 3 months later, because of the off and on infection, a cavity had developed and had gone beyond the inferior dental canal. So rash remarks made later led to a long-running medical legal case. And the private sector dentist, he gave evidence in court. All I did was try to remove the tooth, the whole tooth, and nothing but the tooth. That's gone. So, one thing though, more and more clinical errors are attracting attention from the disciplinary authorities. That's something you have to keep in mind. It's not just about a court case. It can be something before the General Medical Council, the Malaysian Medical Council, say, or departments in boards, say. That's gone. Now, right? The public need to know if someone who praises a drug is getting money from the company. Very important. Next, let's see. Wrong conduct. Let's see. This happened in Singapore. Suspended for attempting to record another doctor showering at the hospital. That's gone. It's a bit detailed, but let's go on to the next one, please. I'll explain what happened. Let's go on to the next one, please. Can we look at the next slide, please? I'm trying to get it going. How do I? Oh, oops. Got it? May we look at the next slide, doctor? Okay. No, sorry. All right, let's stop there. All right, now, this doctor trained in Australia and he got into trouble in Australia for misconduct like this. Then in Singapore, he got into trouble again. He was very lucky that he was not removed from the register. So very important. You can see that at the end. Right? That the second time he committed the same type of sexual misconduct over a span of just a few years. It's very important not just to do well in your practice, have a life outside your practice. Don't use your practice as an opportunity for, say, gratification of a sexual nature. Find a girlfriend or boyfriend, outside practice. Enjoy life with that person outside practice. Very important. That's gone. Yes. That's gone now. So, data breach. Medibank has got into trouble in Australia. By the way, just earlier this week, Qantas Airlines too suffered a data breach. And this is becoming, very frightening, Technology has brought in a lot of benefits, but it is also putting us in a vulnerable situation. Let's go on, please. All right. So Medibank got punished for it. Let's go on. All right. Let's go on. Let's do the next one. I edited this. I don't know what the result was. It came out last year in court. And the doctor was charged. His name was published in the media, but I've not included it here because he is innocent until proven guilty. Let's go on. Oh, it's here actually the name, sorry. All right. But look at it now, the kind of difficulty that arises. Let's go on. Let's go on. Let's go on. Look at this. In Singapore, doctor asked the patient embarrassing questions. He was treating her for upper respiratory tract infection. He asked her personal questions. Not right. Let's go on. Right. In London, plastic surgeon falsely claimed his sister was killed in the September 11 terrorist attacks so that he could get time off from work. He had lied. Not right. Let's go on, please. So, tooth error. So, wrong tooth being removed. Difficult to defend. Let's go on. In Singapore again, 3 doctors not having valid practicing certificates. They were charged in court. We have seen this a number of times in Malaysia. Doctors not having an annual practice certificate or engaging somebody who does not have an annual practice certificate. We have had instances, of course, where unqualified people like, say, medical assistants, medical students have been engaged as locums. You get into a lot of trouble as a result when caught. Let's go on. So here, illegal abortion. The doctor made things worse by lodging a police report for non-payment. Non-payment regarding an illegal act is just asking for trouble. Let's go on. All right. There can be adverse publicity when things go wrong. Right. Let's see. Look at this from Australia. Can you see the plate on the left-hand side of the image? It should have been on the other side. So it was a wrong side case. Let's go on. So a newspaper headline, metal plate in the wrong hip. Let's go on. Look at this. Patient suffered an amputation of the wrong leg. But what happened? Patient said he and the doctor were, quote, both upset, unquote, when the doctor amputated the wrong leg. But the patient decided to sue only after the doctor sent him a bill. Don't bill for your mistake. Right? Let's go on. 2 women with the same name. One for removal of the kidney stones, another for a hysterectomy. And there's a mix-up. Can you imagine in your busy clinic, a nurse steps out of the consultation room and calls for Muniandi, say, and there are 2 Muniandis there. One is outside, on the 5-foot way on a phone. He's the one supposed to come in, but the wrong Muniandi goes into the consultation room. Or the nurse calls for Hamida binti Ahmad, and Hamida binti Muhammad comes forward. This kind of mistakes can happen. So be careful about names. Right? So let's go on. Look at this retained forceps. I once had a court case where the judges of the Court of Appeal were shocked when they heard not one pair of forceps, but two pairs were found in the patient years after surgery. Difficult to defend that. Let's go on. Look at this one, butterfly nut. This from the UK. Butterfly nut had come off a retractor and was found in the patient's body. Difficult to defend that. Make sure that your equipment is complete still. Let's go on. Communication and recording errors. Let's see this one. In 1947, this case was decided. Surgeon said cocaine. House surgeon was then unqualified heard cocaine. Now, a house surgeon is not authorized to write a prescription for cocaine. Pharmacist made no inquiry, did not call for a prescription from a qualified person. Pharmacist dispensed cocaine. So the liability was found because of system failure. Difficult to defend this kind of a case. Let's go on. In Hong Kong, a doctor left the word acute out of a dying heart patient's diagnosis because he didn't know how to spell it. So it ended up in court. Right? An inquiry was held by a coroner. Has to be careful here. He was writing a referral letter. Right? He just wrote, he left out the word acute, so the doctor to whom the case was referred did not see it as that serious. Just a case of referral for angina. Let's go on. Bad handwriting can kill. Can you see at the top? What drug is it? Looks like Plendil, right? Actually, the doctor wrote isodil 20 milligrams. So bad handwriting can kill. The pharmacist or your dispensing nurse may misread it. Plendil. Incidentally, Plendil doesn't come in 20 milligram doses. So that itself should have alerted the pharmacist or the dispenser. So liability was found. Let's go on. Can you see the first one? Intal for asthma was read as Inderal, a beta blocker, which the patient did not need. And the patient died. So bad handwriting again. So your clinic nurses, if they are dispensing a drug, they should be trained to check when in doubt. I've noticed sometimes the dispensing nurse will go back into the consultation room and ask the doctor, this is what I'm going to give to the patient. So the doctor checks, So that's good to see that kind of practice. I mean, it may take up a bit of time, but better that you spend time like that, checking, instead of rushing through something and then causing an accident. And then you spend a lot of time trying to defend, say, a claim or a complaint. Let's go on. So, can you imagine this kind of headline? 22,300 patients a year. So they recommended ending handwritten prescriptions. But these computers with their spell check and autocorrect, you write spinal fracture and the autocorrect decides to take over and says spiral fracture. You write patient's eye was infected and autocorrect tells you it is injected. So careful about autocorrect. Just, printing it out, say in type may not really help, even handwritten prescriptions. I'm not saying they're wrong, but please, you must write clearly. Once a lawyer got into trouble, in a court case, took up an appeal in a criminal case to the High Court from the Magistrates Court. One of his grounds of appeal was the learned magistrate decided the case on inadmissible evidence. But his handwriting, I think, was so bad, his secretary, when typing out that note, wrote abominable evidence. And in the High Court, the judge asked, what is this abominable evidence? Huh? But still, that lawyer, after getting the scolding, managed to win the case. Let's go on. Is this the way to write notes? Can you see somewhere near the middle? A, B, C, D, E, F, G, H knows a lot of. That's not the way to write, especially if you have locums working for you, if you've got other doctors working in the practice, and your clinic staff need to read your notes. Can they understand? Difficult. So please take the time to write something. Let's go on. Look at this. 6 times the correct dose of diamorphine was given. Let's see. Next slide. He just reached into the medicine cabinet in his surgery before rushing to a house call. Picked up a familiar looking box. Patient died. Let's go on. He was convicted of manslaughter and struck off in 2009 after admitting the fatal error. He received a 15-month suspended sentence. Right. Let's go on. He said, I picked up the wrong box. The color looked right, but all manufacturers have different colors, he said. 2.5 milligrams comes in exactly the same box as 30 milligrams or 100 milligrams. Because the dose was labeled in such small type. You see, all these things matter. By the way, I've noticed lately, why are pharmaceutical companies fond of the color pink? Can you imagine a patient? It's got 2 or 3 different types of medicines, and they're all of the same color. The danger, especially if the sizes of the pills or capsules are about the same thing. Can you imagine how mistakes can arise? Overdose, no dose, underdose, all these things can happen. In fact, we had a case here in Malaysia where a patient was given 5 times the usual dose of ketamine during surgery. Now, it appears that what had happened was supposed to give, say, maybe 1 milliliter. I mean, not 1 milliliter. Let's say 5 milliliters. I'm not sure what is the usual dose for ketamine. So let's say it's 5 milliliters. But it comes, say, in a vial, which multi-dose vial, say 5 times 5, 25, say 25 milliliters. So he injects the whole lot into the patient because he's so used maybe to the 5 milliliter vial, he just thinks that way, takes the bigger multi-dose vial and uses it that way too. These kind of things can happen through force of habit. You end up doing the wrong thing. A young man paid with his life in Singapore. This is about mobile phones. Mobile phones can be very dangerous, Now, in Singapore, what happened was a lot of people were waiting at a pedestrian crossing. The light was red. He too waited there. The light was still red and the road was clear. A number of the pedestrians moved forward. Typical, right? They don't wait for the light to turn green. Unlike in Germany, they'll actually wait, Even there's not a car inside, they'll wait. Even if the light is red, they'll wait. Anyway, when a number of them walked forward, this young man was looking at his mobile phone. All he could sort of see peripherally was that people were moving. So he thought the light had turned green. He went forward and a car slammed into him. He died. Look at that. Let's go on. Tampering. Can you see in the middle? On examination, superficial cut, etc. Right thumb, tendons intact, sensation, movements, needs suturing, etc. But actually, what was written was only this. Next slide, please. Only this one. On examination, superficial cut at right thumb. The rest of it was not there. Somebody had photocopied the notes as they stood, and then this doctor later on added these further details. If you make a late entry, mark it as such. Very important. Mark it. You can even squeeze in words, but say it's a late entry. So that's something I think to keep in mind. Let's go on. Now, this slide is a bit faded. Can you see somewhere in the middle, on the right-hand side, rubbish. I don't need your professional query advice. What the doctor wrote here was hypoglycemia, shock. Oh, no, not shock, sorry. Hypoglycemic, I can't make out the rest. The other doctor disagreed. Don't carry on a quarrel in the case notes. That I think is important. It's not professional. Medical counsel won't like it. Judges won't like it. By the way, let me say one thing. Generally, doctors get treated in court better than lawyers are, if that is of any comfort to you. Let's go on. Now, poor clinical description and which side? Little finger, bugger. Bugger is not a proper clinical term. Was it lacerated, fractured, dislocated, swollen? And on which side? This is not the way to write. Let's go on. Practicing beyond the level of competence or delegating to the incompetent. Let's look at this. Plastic surgery by a general practitioner, not properly qualified, very poor results, difficult to defend. Look at this next one. Liposuction by a general practitioner, horrible results. Again, difficult to defend. Let's go on. Forgetfulness or lack of attention. Look at this. Next one. The doctor had used the tip of a rubber glove as an improvised tourniquet. And you can see he removed the ingrown toenail, but the tourniquet remained in place, gripping the toe very hard. The result is ischemic damage. The toe had to be amputated. Difficult to defend. Don't be forgetful. Next one, please. Again, ischemic damage. POP applied. There were complaints by the patient. Usually there'll be the pain, the swelling, difficulty in moving toes, the color of the toes, all these things. So that failure led to this kind of a condition. Next one, please. Inadequate assessment. Look at this. Look at this one, please. The next one, please. Look at this. While he was hammering, something flies into his eye. On examination, superficial ulcer on cornea. Treatment, chloramphenicol eye ointment. That is not sufficient. Inadequate. Look at this. Next one. Later on, a metal piece was discovered on an X-ray film. Again, later on. Next one, please. The result, through ophthalmoscopy, a metal fragment. The result, a blind eye. Next slide, please. Difficult to defend because of inadequate assessment. Let's go on, please. So, How do we avoid medical legal problems? Practice good and courteous communication with patients and colleagues. Keep at a reasonable level patients' expectations. Write and keep proper medical records. By the way, about keeping medical records, the background material that you have contains material on medical records and for how long you should keep them. Please use them as a guide. Practice at the appropriate level. Delegate tasks only to the competent. Let's go on, please. Undertake sufficient clinical assessment of cases. Be compassionate. I'll never forget an incident which came out in a newspaper in 1964, I think. Somebody wrote to the newspaper complaining of the conduct of a nurse in a hospital ward. An elderly Indian patient had died one night. His wife did not know that he had died. She came during visiting hours the next day and she found the bed empty. She looked around. The nurse called out from her station, "Awak punya laki sudah mati, pergi cari dalam mortuary." That is a disgraceful way of dealing with the situation. The poor lady collapsed in a heap, weeping. That's the thing. You must not lose this sensitivity. You may be desensitized to pain and suffering and death and all this in your work. But still, you have to think about what it is like for them. They are not used to such things, seeing it every day. Avoid making rash remarks about patient care and management. Be prepared to give opinions to patients in medical legal cases. Have a simple and effective complaints procedure. Because a lot of grievances can be dealt with without having to talk to lawyers, without having to go to court or anything. Deal with their complaints. Right? Let's go on. Now, before we adjourn at this stage, I want to say something about my mentor, Dr. M.K. Rajkumar, formerly the president of the Academy of Family Physicians. I owe a great deal to him. He was my mentor. I am grateful to him for what he had done. And he passed away in the year 2008. Last year, in memory of Dr. Rajkumar, I endowed 2 separate prizes in medical ethics. One in the Faculty of Medicine of the University of Malaya, and another in the Yong Low Lin School of Medicine of the National University of Singapore. And I hope that the Academy and members of the profession will support the prizes. I'm not calling for money, I'm calling for support, because what is important is that the profession should recognize Dr. Rajkumar. And I believe that these prizes will help to raise standards of practice in the medical profession. And I hope that he will not be a forgotten man. Right? So I conclude the slideshows with this, and I would like now to go on to the case studies. We can take a minute and then we'll have the first slide, all right? The case studies. Ready, Vicky?
Yeah, I'm looking for the slide. Just give me a minute.
Okay. Case studies.
Case studies, yes. Yeah, found it.
Yes. I'm afraid time does not permit me to answer many questions, maybe one or two, but if there's no time, what you can do is write in with your questions, and I will endeavor to answer them without delay. Right? By the way, I said without delay. One of the things I frequently tell doctors is they should not delay in their work. One of the complaints people have is delayed diagnosis, delayed treatment, all these things. All right. Now, so you can send them in, and I will see what answers I can give. Right. From time to time, I have received questions. Let's look at this one. Doctors, look at the dates. They're very important here. The dates. Saw the patient on a Saturday. He had not gone to work on the Friday. Right. But the doctor, he decided that the patient was likely too ill on the Friday to go to work. And that on the Saturday, you're still too ill. Now, keep in mind, some conditions may persist for a number of days, right? You may see a patient and you tell her, it looks like you're 10 weeks pregnant, for instance. Or say, you look at a wound and you say, this wound is, say, about a week old. You can tell. Now, the doctor issued a medical certificate dated the Saturday. He did not backdate it. Keep that in mind. He issued a medical certificate on the Saturday, and he said he had examined the patient on the Saturday. Then, in his opinion, the patient was unfit to work on both the Friday and the Saturday. Now, a lot of people misunderstand this to be a backdated certificate. It is not. But he certified the patient ill on the day before. He said he had the evidence. What the patient said, his findings on examination, etc. So the employer complained. And another thing, the employee wanted to know what the patient's medical problem was. So two things. One is that the employer thought that the doctor had issued a medical certificate for the day before and that was wrong. I've checked with experts in the UK. They said it's not wrong so long as the doctor had evidence to support his opinion. The employer wanted to know what the patient's medical problem was. Confidentiality. So that's very important. So, please keep that in mind, all right? Now, if the findings on the Saturday showed that the patient was probably well enough on the Friday to go to work, then the doctor should give a medical certificate only for the Saturday. That I think is very important, all right? Please keep in mind, I have seen this one. By this is a true one, true story. Right? And there was a lot of trouble over that, but the employer did not pursue the matter. Right? Let's go on to the next one, please. Okay, male doctor receives a visit from a 45-year-old lady of his who has been his frequent patient over a period of 25 years. Happy and totally professional relationship. She needs an abdominal examination, but there's no chaperone available immediately. The patient says that it is not necessary to wait for a chaperone. Now, the medical council has an inflexible rule. There must be a chaperone. Now, I hope that the medical council will review its rule. It should say that as a general rule, there must be a chaperone. If a doctor does not have a chaperone while undertaking a medical examination of a woman patient, in the case of a male doctor, that doctor must be ready to justify the absence of a chaperone. You see, in this example, is there any mention of an emergency? Can the lady wait? She can, right? That's one of the things. Now, of course, should the doctor be criticized? No chaperone. He said not available immediately. So he could get somebody to come in. Now, I have looked up literature on the point, European literature, which shows that there is no rule in quite a number of places in Europe about having a chaperone present during a medical examination. In fact, there have been cases where patients did not want the presence of a third person. How many of you have seen this? Young woman and her mother-in-law wants to be present. Think about that. There may be, say, someone present, say, young woman and her mother, say. She's asked some questions. The young woman looks at her mother, and the mother does the talking. You see, the presence of a third person can interfere. I remember one case where a doctor just couldn't continue with the treatment of a lady's condition because the husband kept interfering. Could become a big problem. So please keep in mind that there shouldn't be an inflexible rule. So I'm raising my concerns about the medical council's guidance. I feel it needs to be reviewed. General principle, you may say, yes, there should be a chaperone. But no, this is all defensive medicine. No, it's for the protection of the doctor, not for the protection of the patient, you may say. But then think about this. There can be vulnerable patients of either sex or any sex. Should I say any sex now? There are so many sexes nowadays, right? I'm getting so confused, of any sex. Sounds nice. Any sex, right? So, should you have some kind of rules about all this? But important point, there should be some flexibility. For instance, in an emergency and there's no chaperone available, what do? Let's go on. Look at the next one, though. The facts are somewhat different. Male doctor, solo practice, unaccompanied 16-year-old female patient, not seen her before, emotionally disturbed, playing truant, boyfriend problems, drug dependent, possibly. Freely admits to being sexually active, vaginal itch, no chaperone present. She does not want a chaperone present. She forbids the doctor from telling her parents of her problems. Now, look at this. This is a far more serious case. It would be dangerous, right, for the doctor to attend to this patient without a chaperone present. That's something to keep in mind. But she does not want a chaperone present. Now, a few things. Should he refer her maybe to a big hospital to say, look, this case is beyond my level. Maybe there'll be a woman doctor there who can see her. That's one possibility. Can she be just left untreated? No, look at her kind of condition. Right? That's another thing. Then you have to also look at this. She might give you trouble if you're a male doctor and this happens. So you have to be cautious. Now, 16 years old, you're all been told, right, if the patient is under 18 years, consent from the parents must be given. I question it. I question that rule. I know the Minister for Private Sector Hospitals has given the age of consent as 18 years. Why I question it? I've studied the matter thoroughly. We have got the Penal Code of Malaysia. The age for consent in the Penal Code of Malaysia is 12 years. You see, there's been this confusion between age of consent and age of majority. Age of majority is for like casting votes in the election. Say, no, entering into a contract, say. enlisting for military duty. It will be at least 18 years old, say. Do you know the age of consent for sexual intercourse in the penal code is 16 years? So, if the girl is under 16, can you go and ask consent from the father or mother? You can't. But I've looked at the penal code. The age of consent for treatment is 12 years. Now, she does not want a chaperone. She forbids the doctor from telling her parents of her problem. In the UK, in this kind of a situation, the age of consent is 12 years in the UK. I've checked the point that when it comes to confidential information, the cut-off age is 12 years for consent to disclosure of confidential information. So keep that in mind, please. All right. But it's a very complex subject, consent, confidentiality. My youngest son, when 12 years old, was taken by me to see a doctor. I decided I won't go in to see the doctor. I told my son, you go in and see the doctor. When he came out, I asked him, what did the doctor say? My son replied, confidential. I didn't dare ask him anything more. That night, I got a scolding from my wife. Now, another complicating feature, in the UK, when it comes to contraceptive advice and treatment, the ordinary cutoff age is 16 years for consent. But a rule has been established in the UK that in the case of a girl under 16 years, contraceptive advice and treatment can be given if she has sufficient maturity, sufficient understanding and intelligence. They use the expression, the Gillick competent child. Gillick, the name of a case in the UK. Competent. There's one case where a doctor gave contraceptive advice and treatment to an underaged girl. But he also went on and did this. He informed her parents, I'm giving her contraceptive advice and treatment. A women's advocacy group made a complaint against the doctor to the General Medical Council for breach of the duty of confidentiality. The complaint was dismissed. The General Medical Council upheld his decision to provide contraceptive advice and treatment to this underaged girl without the consent of the parents, and also upheld his decision to inform them, that's something different, of that confidential information. Complex subject, please be careful about this. It is too simplistic an approach in this country to take the age of 18 years as the cutoff age. If age of consent is 18 years for sexual intercourse, look at the penal code. It says age of consent is 16 years. And if the girl is, say, 15 years and lawfully married, consent is irrelevant, And that I find a bit troubling. Her consent is irrelevant. That means she has to submit to her husband at whatever age, if she's lawfully married. Something for women's organizations to look at. Let's go on. Sorry. I have a question also about number 3. Should the doctor contact the patient's parents? My advice will be at the beginning is say, no, I won't. I'll just respect your wishes, but try to persuade her. Because the moment you say, yes, I will tell, you cannot take it back. Then, should he contact the school, the police, or the welfare department? The easiest is the welfare department. You know why? The welfare department is in a protective position under the Child Act. Protection. The police are more concerned not with protection, but with matters of crime, say. The school, education, some element of protection. But I think The welfare department will be the easiest to deal with. They are more particular about confidentiality, by the way. Let's go on. Let's look at this one. A police officer visits a doctor. Unmarried 20-year-old sister's consultations. Parents are worried that the young woman is sexually active and is taking contraceptives. The doctor has no such information. The patient's consultations with him show nothing sensitive, but he had noted that she had complained to him of too much parental control. Important. Can the doctor answer the police officer's questions? Look at it. Was the doctor on duty? No. Please keep that in mind. Here he was on a personal errand. But he was concerned about his sister. You know what I normally do when members of the family say, see a doctor and ask him, about, say, someone else's problems, husband wanting to know about the wife, father wanting to know about the daughter, say, I usually tell the doctor, I've given the information to your daughter or your wife or what, please ask her. Don't appear to be obstructive. You say, I've given it to her. It's not for me to give the information behind her back to you. I have to respect her. But keep in mind this, family members may be naturally, properly concerned about patients. And that's something to keep in mind. Right? So, when we have this point that the police officer was not on duty, surely the records cannot be shown to the police officer. Should he tell the patient about her brother's visit? You have to ask, what will happen if you tell her? You can always say, well, nothing much, I don't have to, bring it up. Should he contact the police officer superior? Might be making things worse. The boss might scold him. You're supposed to, work here, not look after your family's problems like this. So exercise some discretion. I always say this, better not to disclose confidential information. You can always disclose it later. Because once you have disclosed the confidential information, you cannot take it back. All right? If you have questions, of course, please send them in. All right? Let's go on. Look at this one. Again, ask yourself this question. Was the police officer on duty? Murder. Young, unmarried, pregnant woman. She had mentioned to the doctor that her father had committed incest with her and had got her pregnant. The police officer wants to take away the medical records and to also question the doctor regarding the patient's consultation with the doctor. But please keep in mind, unlike in the first one, in this one, the police officer was on duty. A serious criminal offense. Right. Now, I am certain at least some of you would have been told you have to get a court order for the police to obtain the medical records. I will say straight away, nonsense. The Criminal Procedure Code contains provisions for the police to take away medical records from a clinic when investigating a crime or a sudden death for the purpose of an inquiry into a death. Very important. No need for a court order. Right? You have all been told, I think. I think all of you have been told, must get court order. No, I say. Of course, the sensible thing will be, of course, keep copies of the medical records when you hand them over to the police. And also this, the doctor can question, the doctor has to answer the police questions regarding the patient. That is the law. Why? There's a public interest element involved. Criminal matter. A serious crime. Right? Let's go on. Middleman's recommendation, a locum, did not check the locum's personal and professional details. Doctor left in a hurry as he had a political party seminar to attend. You see, so many doctors are now in politics, Right? Now, the locum, although a registered medical practitioner, was not in possession of an annual practice certificate. I said discuss. The locum is a registered medical practitioner. He himself will get into trouble. In court, he can be charged with the criminal offense of practicing medicine without an annual practice certificate. He can also be punished, by the medical council for such conduct. Now, what about the employing doctor? He too, for assisting in the commission of the offense, he can get into trouble in court, in a criminal case, and before the medical council. And we have seen this from time to time. Important thing is check your locum's details. Personal and professional. Personal meaning like say what? What is the locum's name? Some of them, may have names which are very different from what they say to you. Look at their identity cards. Their contact details say. Right? Then the professional details. Does he have an APC? That's the simplest point. Please, please, please. We have seen enough of these kind of cases. It's not good. You get into a lot of trouble with your patients and the public. Next slide, please. Look at this. Child's dose, powerful antibiotic, 6 years old. Employee, 17-year-old girl who had left school the month before, not trained as a nurse or a dispenser. She did not check the prescription. She dispensed an adult's dose of the antibiotic. The result, the patient was ill in hospital for. So this was a case of delegating a task to somebody who was not qualified, not trained, not guided. So difficult to defend this. This is more an administrative error, really. Not an error of judgment. So this is a true story, by the way. And sadly, it came out in the media. Next one, please. By the way, sorry, one more thing about that one. Let's go back to one, number 7. Fortunately, that little girl had no serious, long-lasting injuries. Ill for a number of days, but we settled the claim and got on with our. Let's go on to number 8, please. A young unmarried Muslim woman visited a doctor for a pre-employment medical examination. No X-ray examination because clinic nurse had noted by mistake that the patient, although unmarried, was pregnant. The information was actually as regards another patient. Look at that mix up in the records. We have seen this from time to time. Wrong patient is described as being pregnant. The doctor's report to the prospective employer contained an explanation that no X-ray film was taken because the patient had said that she was pregnant. When the employer asked her about it, she denied that she was pregnant. In fact, she was not pregnant. The doctor, having made a mistake, what should he do? Straight away, of course, we'll say is, don't tumberang, apologize. And in fact, in this case, this is a true story. In this case, the apology was accepted and the girl got her job, by the way. So happy ending. She could have sued him for defamation, right? To say of a young unmarried Muslim woman that she was pregnant was to suggest that she had committed zina. Of course, now we have got artificial means of getting pregnant, but still, many schools of Islam don't accept, say, this kind of artificial means of getting pregnant. So it would be seen as though she had committed an Islamic offense. But keep in mind, in the law of defamation, this is something you may find a bit strange. Even though what you said was defamatory, you can still be protected if you said it to the right person. That is, here the doctor said it to the employer, she's pregnant, and actually she's not. But the doctor in good faith said it, even he had made a mistake, but he'll be protected by the law. But if you go and tell your, say friends or others, outside who have no interest in the matter, then you get into trouble. But here the employer had an interest in the matter. But whatever it is, there was a problem here. He could have got into trouble with the medical council for misconduct. So happy ending anyway. Let's go to number 9. This is also a true one. Patient said he had slept with a prostitute the night before. GP prescribed a sulfonamide. What happened was, the doctor had failed to read the records following the telephone call. This was telemedicine. You see the dangers of telemedicine. He handed the drug over the counter to the patient's messenger upon request and without seeing and examining the patient. This was a case where it was necessary to see the patient and at least read the records. By the way, in countries like Singapore, more and more now there are these teleconsultations, but only in appropriate cases. Patient suffered severe erythema multiforme. Only then he went to see the doctor. Doctor stopped the sulfonamide, gave treatment, etc. 19 days later, the patient was admitted to a hospital suffering from an asthma attack. He recovered after treatment by a physician. The patient sued the doctor, alleging negligence in prescribing the sulfonamide. And this is an important part. He pleaded that the injury suffered as a result of the negligence was the asthma attack. He did not mention the Stevens-Johnson syndrome. Important point. The physician, when called to give evidence, said that the sulfonamide did not cause the asthma attack. Remember I said, right? In negligence, there's a need to prove that the breach of the duty of care caused reasonably foreseeable damage. Caused. Here, causation was not established. The asthma attack had nothing to do with the sulfonamide. The physician said the asthma was caused by an upper respiratory tract infection, unrelated to the sulfonamide. So, the case went to court. Look at it. The doctor was negligent, but the judge had to dismiss the claim. Right? So, not enough. In negligence, you must prove damage, which was reasonably foreseeable. But in battery, that is an intentional wrong, like treating the patient without consent. Even though no harm was caused, you get into trouble. So please see the distinction between negligence and battery. Most of the claims that come into court in regard to medical treatment are in negligence. Very few are in battery. Next one, please. So the claim was dismissed. Keep that in mind. But the doctor could have got into a lot of trouble with the medical council for practicing telemedicine in an inappropriate way. Look at this, number 10. Doctor employed as an assistant in a family medicine clinic resigns, sets up independent practice, etc. He obtains names and contact details of some of the patients kept at the employer's clinic. Right? He invites them to consult him at his new practice. Now, this is about a doctor's duty to a fellow doctor. Is this right? That's simple. He should not be doing such a thing. As he was taking advantage of the inside information in the earlier clinic and trying to use it in his new clinic. In the UK, there used to be cases like this, milkman's list, the milkman will go around, right, delivering milk. Then the milkman joins another company, and then he uses the list that he had obtained from his previous employer to try and win customers. And that will be seen as wrong, right? So this is something to keep in mind here, all right? You owe a duty to your fellow doctors not to take an unfair advantage. Let's go on. Number 11. Medical rep offers a doctor free samples. He asks the doctor to prescribe that antibiotic and to suppress the prescription and dispensing of a competitor's antibiotic. This is a commercial point being made. The doctor must prescribe drugs on clinical grounds, not on commercial grounds. So difficult to defend this kind of a thing. Let's go on. Patient's lawyer asks the doctor to, quote, correct, unquote, his medical report on the patient who's claiming damages in court because you're suffering from depression after her son died in a motor vehicle accident. The doctor's case notes on the patient show that he had consulted him on a number of occasions for insomnia, moodiness, and tiredness. The doctor thinks that there is insufficient ground to diagnose depression as requested by the lawyer. First of all, the lawyer should not be interfering like this. It's a simple. There will be misconduct on the part of the lawyer. Now, this insomnia, moodiness, and tiredness, they may be related to her, sadness following the death of her son. But here, if the doctor thinks there's insufficient ground, instead of having a quarrel with the lawyer, the doctor could probably say, I will refer her to a psychiatrist. Let the psychiatrist come to a conclusion. I will give a proper referral letter with all the necessary information. That's why I always say, as far as possible, avoid confrontation. Family members want to know, you say, well, I've given the information to the patient, you can get the information from that patient. Lawyer wants you to correct something, you say, no, this is not my field, I will refer the case. It is not about avoiding problems, it is about dealing in a proper professional way to a request like this. But I think the lawyer was wrong in telling him to correct his medical report. That's gone. Medical officer, now this is a bit more complicated. Amenorrhea, 11 weeks. Ultrasound machine was out of order. Actually, at the time when this case took place, that clinic did not have an ultrasound machine, right? But they were just making their appearance. And the nearest ultrasound machine was 55 miles away in a big hospital. Anyway, but here I put this in out of order. Top tone machine available. Could not detect fetal heart. 11 weeks can be tricky. Slight bleeding. Urine pregnancy test positive to a dilution of 1 in 1124. That is high dilution. Uterus larger than dates. He diagnosed a molar pregnancy. He advised the patient that her pregnancy was not normal. Advised DNC. Patient felt worried and disappointed. That's gone. So she went to the government hospital, right, for further management. 2 days later, MO in the department there took an ultrasound scan. Normal looking fetus of about 10 weeks gestation, able to detect the fetal heartbeat. Right? Now, so the patient was reassured, gave birth to a healthy baby, which she brought that little girl to court as evidence. There was a claim in court. Straight away, I'll say the claim was dismissed. Look at it. Okay, maybe the doctor should not have been so positive and said, no, molar pregnancy. So just say, look, I don't have an ultrasound machine. Top tone, I could not pick up the heartbeat of the fetus. I'm referring you for further management because your urine pregnancy test result was, high, to a high dilution, right, etc. So I need to get somebody in the big government hospital to look at the case. So there's no negligence, no compensation should be paid. But this, I will caution you, please keep in mind, don't be too definite, especially when you're referring the case. Because you say this needs to be assessed. Just like the earlier one, about the lawyer asking the doctor to certify that the mother was suffering from depression, is to say, I cannot certify that. I will refer this to a psychiatrist. So here, this is something that caution is required. But mind you, he made a diagnosis of a molar pregnancy. It was wrong, as subsequent events showed. But he went on the available evidence. And it was something that a reasonably prudent doctor would have said in the circumstances. Right? So, but there was no damage. The mother had a normal baby. But her husband came to court, said, all sorts of things. I was very upset. I started drinking more. I started quarreling with my wife. The mother-in-law came and she was making a lot of noise, shouting in Hokkien in court. I asked some question and straight away the mother-in-law said, Bola. And I said to the judge, I don't need a translation. I know what she's saying. Anyway, sometimes you get some excitement in court. Let's go on. A doctor had to perform an emergency cesarean section on a patient who was in a semi-comatose condition. He obtained the husband's signature on a blank consent form. Both mother and baby died. Filed a negligence claim. Well, from the facts, there was actually no negligence. But one thing I did not like was the doctor filled the details into the form, acting on the advice of his lawyer. By the way, I was a lawyer, but I'm just making this up here, okay? I didn't tell him to make it. I was shocked. I said, blank consent form. How can you do this? I scolded him. And then he gave me a consent form with the details in. I scolded him. I said, if this goes to court, I'm going to tell the judge that after I scolded him, he wrote this in, but the details are correct. Name of patient, the procedure to be performed, etc. But one thing I told him also is, what's the point of getting a consent from the husband? It's meaningless. But then we've got a private healthcare law which says, next of kin, members of the family can sign a contract. Not necessary. The penal code, again, I mentioned the penal code, something which is hardly ever mentioned, I'm sorry to say. It says that in an emergency, you can proceed without consent if the patient is unable to give consent. It's in the penal code. A lot of medicine is mentioned in the penal code. Please, the next time you have contact with a lawyer about a medical legal case, ask about consent. It is there in the penal code. So here it was an unnecessary consent form. This is all the bad influence of lawyers, By the way, some people think something is good only if it is in writing. Only if it's in writing. All right. Consent in the penal code. Consent to sexual intercourse. The offense of rape without the consent of the woman. How many women give consent in writing? How many? Consent can be express or implied. Express consent can be oral consent or written consent. Implied consent, the way they act. A lot of sexual contact takes place in an implied consent way, right? Anyway, I've said enough about consent. I'm very frustrated about how the law has been understood. Let's look at this next one. I'm sorry, we are running out of time. Just a couple more minutes, doctor. Jehovah's Witness, 6-year-old boy,
sure.
refused to consent to urgent blood transfusion. They wanted alternative treatment. Actually, can hardly think of anything. How much can Hemocell, Hartmann solution, these volume expanders do? The doctors were What can they do? Simple. In this kind of thing, the parents cannot give consent. The court, the welfare department can take over. My advice in such a situation is where the child needs urgent medical treatment and the parents stand in the way, go to the welfare department. That's one. Even more, say strongly, go to court and get an order. And this has been recognized. The American Supreme Court once said, parents can make martyrs of themselves, but it does not necessarily follow that they can make martyrs of their children. Let's go on, please. Last one. The last one, please. Yes. A&E department, young woman, 3 nights in a row, vague complaints, tiredness, insomnia, and headache. Third occasion, fever, some stiffness in neck, light phobia. What will you think of? Meningitis. Antibiotics, sedatives, and analgesics, complete rest in bed for 3 days. Is that sufficient? No. Following day, admitted unconscious. It was a case of pneumococcal meningitis. She died the following day. Simple. This was a case of inadequate assessment of the case. Let's go on. See that the last part. Family angry, etc. No lab investigations were ordered. Medical officers say that the patient refused to be referred to a patient, but did not write the fact in the medical record. If she refuses to write, it is good note keeping. He wrote query shamming. That means pretending. How can you write pretending when there's objective clinical evidence, right? Look at the facts earlier. Can we look at the top? The facts, objective evidence. Right? On the third occasion, she had a fever. That's objective evidence. Stiffness in the neck, light phobia. Of course, what the patient says, maybe, question, maybe. But can you write there that she was pretending? So, this was a very unfortunate case, inadequate assessment. The courts will come to the rescue of a doctor who had undertaken proper assessment and yet saw a bad result. Proper assessment, proper treatment, proper advice and information given, yet a bad result. But here, something basic was not done. So, and it could not be defended. And therefore, the doctor would be liable in negligence. Now, I have prepared these case studies following what I'd come across over the years. And I picked out the kind of examples that you would find, I believe, of some use in practice. I hope that these case studies have helped to focus your mind on what is involved in regard to the interaction between law and medicine. But please keep in mind, I repeat this point. Generally, doctors get treated better in court than the lawyers are. You should keep it that way. Right? I wish all of you a successful career and that you'll do very well and that you do not have to see a lawyer. Actually, my ambition is to become a stand-up comedian. But my wife warns me. By the way, my wife is an anesthetist. She warns me, what if the audience doesn't laugh at your jokes? I'll leave you with that. So thank you all. Bye.
Thank you, Mr. Ranjan. I think a very informative and a very decisive talk. I think a lot of examples that, you can't get just by reading books or just attending all these conferences. I think very interesting. You summarize very concisely, what are the cases and, how we deal with it. So it will help all of you all. Later, as for the Q&A, what we'll do is later I will provide the student a link where they can actually give the question, and then maybe on Monday or Tuesday,
Okay.
forward to you. And also for the claim link, I think next week I'll submit to you once I get the link. Okay. So
Yeah.
thank you very much, Mr. Ranjan.
Thank,
We hope to see you in
thank you.
the first week of
A pleasure.
January. We'll inform you accordingly. Thank you very much.
I would like to know about the date because whether it will be Saturday 3rd January or Saturday 10th January, because I'm going to do my 4th run for Anti-Slavery International in Malaysia. And
If I think most probably we still stick with the first Saturday. If there is any changes, I'll let you know. But we are always flexible. Like if you need to do that, you can do it. Then we can move your lecture to the fourth.
no, I was thinking about
Sunday.
this, if you're going to take the first weekend, you see, right, 1st January is a Thursday. A lot of people
Yeah.
take Friday off, Saturday off.
Yeah.
I
Okay.
can do my run on Saturday, 10th January, if you decide to, but I need to know early so that I can,
Yeah. I'll
adjust.
double check. Inform you by next week.
Mm.
But I think tentatively will be the first week still, so that they don't disrupt because what
Okay.
happened, the academy, they got different programs for different years and
Okay.
intakes and so on. But anyway, I will inform you next week and get
Okay.
decide.
All right.
Thing. Okay.
Thank
Thank
you
you
very
very much, Mr.
Thank you.
Ranjan. And
Thank you.
okay, so okay, thank
All
you.
right.
See you soon.
Okay. Bye. Bye.
Okay, for the rest, okay, you got about a few minutes break before we start our second lecture. Once again, I remind you all to be visible and put your full name, okay, because your attendance are being taken and few candidates have created some problem for themselves by, because of inadequate attendance time, okay. Um I think you all will all agree that the lecture by Mr. Ranjan was very informative, and you have something like very novel that you have not heard anywhere. So keep it in mind. As for the notes by Mr. Ranjan, all are available in your e-learning portal. Okay, as I was told. Okay, if you have any problem, you can let me know. I can
Okay.
pass it to
All
you.
right. Okay. Bye. Bye. Okay.
Okay, bye. Bye. Thank you, Mr. Ranjan.
Thank you, Doctor.
Okay, yeah. So. Okay, so we take a 6 minutes break before we start the second lecture by Dr. Zainab. Okay, I also need a short break. Thank you.
Bye.
Okay.